This lady right here.
Thank you, sir. I'd like to know.
First, thank you for running, and thank you for being real. As the mother of working poor, young 20-somethings, 30-somethings, and as a healthcare provider, I repeatedly see uninsured individuals. And I'd like you to speak to what you plan to do about that, about healthcare as a right. And up there, I was going to also ask you, if you want to segue into this, about your ideas about promoting alternative energy sources so that we can get away from our reliance on fossil fuels. Thank you.
Let me do the energy thing first because it's quick, and then I'll do the healthcare takes a little longer. What we have to do is we have to get a revenue stream so that America, not just private entrepreneurs, are investing in these renewable sources of energy, clean renewable sources of energy. So the way to do that is, and it feels a little warped, but it makes a lot of sense, is to make the people who are polluting today, as we're bringing down the pollution levels, make them pay for the pollution they're putting into the air. And then you use the money that comes from that to have a national fund, energy transformation fund, that we feed into investments in these alternative, clean, renewable sources of energy. So basically, you need the money, you need a national investment, you need to fund the research and the development and the marketing of these alternatives. And the way to do it is take the money from the polluters and make this change in the way we produce and use energy. That's basically the concept. Healthcare. You know, and many of you may know this already. It is true that I came out with the most aggressive and earliest global warming proposal, but I also came out with the first universal health care proposal, which I'm proud to have done. That was many, many months ago. And I think it is core to strengthening the middle class and lifting people out of poverty. Half the people in America that go into bankruptcy. And by the way, you're more likely to go into bankruptcy in America today. I like facing that way because it's warm. They're more likely to go into bankruptcy today than to get a divorce, which is an amazing statistic. Half of those bankruptcies are healthcare costs. Half of them. We have 47 million people that don't have coverage, 2 million more than we had a year ago, according to the Census Bureau. Our healthcare system is dysfunctional. It does not work. It doesn't cover millions of people, and on top of that, costs are through the roof. Completely through the roof. So what I propose is this, is that we mandate coverage for everybody by law. And that's an important question, by the way, when you're looking at candidates. If their plan does not mandate coverage, then you're going to have millions of people without coverage. I can tell you that. Every expert will tell you that. And if they don't cover everybody, they really ought to be made to explain what American is not worthy of health care coverage. Because I don't think there is an American that's not worthy of health care coverage. Everybody else. So mandate coverage. You fill in the cracks that exist in the present system, which means we outlaw pre-existing conditions. It means mental health parity. Mental health should be treated exactly the same as physical health. It means preventive care, which many people don't get because it's not covered. Preventive care, 100% covered. Chronic care, which accounts for over half the health care costs in America, covered. Long-term care, which many of us are going through in our families, we're going through it with Elizabeth's folks right now, is covered, 100% covered. Dental care and vision care are covered. You take your health care with you wherever you go, which means if you change jobs, if you get laid off, you move to another part of the country, you're never without health care. That's the whole plan, of the whole concept of this proposal. And it does have a cost. It costs $90 to $120 billion a year. I do not claim it's free. And it's paid for by getting rid of Bush's tax cuts for people who make over $200,000 a year. So that's the basic concept. I want to mention one other thing about it, which is I had this unique idea about how to maximize pressure on Congress to get it passed, which is I want to, in the first week that I'm sworn into office, to say to members of Congress and to members of my administration, we need universal health care. We need it to be passed by this summer, July of this year. And I'm glad that all of you have health care. But if you haven't passed universal health care for America by this summer, I'm going to do everything in my power to take your health care away from you. Because there is no excuse for Washington politicians having health care when America doesn't have health care. It's a very simple idea, and let's ratchet up the pressure on them. So those are the basic ideas.
Is it a single payer?
It's not, I'll tell you exactly, it's not single payer. I'll tell you exactly what it is. It's a hybrid. You will be able to choose, and every American will be able to choose, between a private plan or a government plan. The government plan is Medicare Plus. If over time people choose the government plan, it can become single payer, which is fine with me. But I want Americans to be able to choose. And there are some fairly serious regulation of the insurance companies that participate. For example, all those things I talked about. They can't deny coverage, no pre-existing conditions, mental health parity. They got to cover all those things by law. And they cannot charge more than 15% profit and overhead. No more than 40% and over profit and overhead. So we regulate them, and we'll see. We'll see what ends up making the most sense for America. That's basically the structure. Yes, sir.
So the high deductible. Yes. Would this plan? I'm in the healthcare field as well, and some patients have extremely high deductibles, which in effect make them probably better off paying out of pocket unless they have major problems.
Yes. Now we set up a deductible system and a copay system that is affected by income. Number one, the health insurance is subsidized up to about $100,000 of income. That's what it boils down to. And so the lower you are on the income ladder, the more protection you get against any deductibles and copays. So yeah, we know that's a huge problem, and that's part of the construct.